I'm a little freaked out right now, to be honest, because I just read the results of the latest Pew Research study around public sentiment around vaccines. And what they found is that in the last 4 years, the amount of people who believe that parents should be allowed to decide when and how their children get vaccinated is now at 28%, up 12 points from 4 years ago. What that tells all of us is that misinformation is rampant and public opinion is changing because of it. There is absolutely no scientific proof that parents should be allowed to make certain decisions about their vaccines. That may be a feeling, and there may absolutely be individual cases where that makes sense. But for a very long time, childhood vaccinations were not questioned, and now all of a sudden, because it's hit the mainstream to deny and to spread false information about vaccines, their efficacy, and what side effects they might have, people now believe that parents shouldn't necessarily have to be mandated to do so. That's 28%. That's more than a quarter of the population. This should terrify us. I'm going to talk about misinformation next week at our ChatGPT webinar. We already have more than 500 people registered, and we'll supply the registration link in this link. But I want to talk about what we do to combat misinformation, because that's a really critical part of what our jobs are as healthcare communicators and marketers. And I think one of the mistakes that we make is because we work with academics and data scientists, we believe that data is going to convince people, and that if they see numbers or graphics, they're going to believe it. You know what people believe? They believe stories, and they believe stories of people that they trust. So as healthcare communicators, it's our responsibility to get out there and find the stories of people who, A, have been vaccine deniers in the past and recognize that that was not the way to go, or to find people who are willing to talk about their experiences with vaccinations in a positive way. This is not a complicated area of science. There are definitely people who are harmed by vaccines. I don't disagree with that at all. But the bottom line is that when you look at what's happened to things like measles, mumps, rubella, since we introduced childhood vaccinations, you can see that the population has benefited. And so for 28% of people to believe that parents should be able to decide when and where their children are vaccinated is a public health emergency. And it's our job as storytellers to find the people who can convince people, or at least create a window of opening in their mind, that maybe they might be wrong about this. Listen, let me tell you something. It's our job to tell the stories that are going to change people's opinions about the way their healthcare should be delivered and about their responsibility to society as a citizen who has to be responsible at his or her own health. I will see you next time, and let's hope the next time we report on this in 4 years, that number has dropped.